The World Health Organization, WHO, declared on January 30th a global health emergency with the new coronavirus outbreak. Virus fears triggered a run on protective masks, and everywhere we go, surgical masks and N95 respirator masks are quickly sold out in many countries around the world. Canada is no exception to this. But which kind of masks would best prevent diseases, and how do we wear it correctly? According to medical experts, surgical masks are used as a barrier to protect the user from splashes or droplets of body fluid due to coughing or sneezing, thereby reducing the risk of spreading germs to others. People can use this type of mask to reduce the risk of a virus infection. N95 respirator masks are designed with more effective filters to protect the wearer from small particles in the air that may contain viruses. They can in fact filter out 95% of airborne particles according to the CDC, or the Center for Disease Control and Prevention. This mask is suitable for health professionals to use when interacting with patients of infectious diseases and is usually worn only for a short time.
Masks, if worn incorrectly, may increase the risk of virus infection. So how do we wear a mask properly and effectively? Please note that before wearing any mask, be sure to wash your hands thoroughly with soap or sanitizer. Put on the N95 mask over your nose and mouth. Mold the hard section around the bridge of your nose without pinching to make it fit snugly. An N95 mask, when fit properly, can also make it more difficult for a person to breathe. The mask must cover both the nose and mouth. Some people wear a mask but leave their nostrils open. This is useless. Once you have the mask on, do not touch it to prevent your hands from getting infected with viruses and other pathogens, which will then pass on to yourself and those around you. When removing the mask, just grab the straps. Be sure not to touch the front of the mask. And it's important that all masks are to be worn only once. Immediately dispose it in the trash when you remove it, and be sure to wash your hands with soap.
Effective ways to prevent getting or spreading viruses as recommended by the World Health Organization and Health Canada are as follows. Washing your hands often with soap for at least 20 seconds or sanitizer. Cover your cough or sneeze into your upper sleeve or with a tissue, then throw out the tissue in the trash. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who show symptoms of fever, coughing, hard breathing. Cook thoroughly meat and egg products. And finally, avoiding contact with wild animals or pets without protective gear. Remember to wash your hands after contact with animals.